itching, odor, discharge, ulcerations, pain and burning, painful intercourse. That seems like a list of like 90+% of the most common complaints that we are going to see as people who take care of vulvovaginal disorders. So you don't have to take them one by one, but maybe just if you have kind of these things, you should go see your doctor type of conversation. And I think that would be valuable for people to understand what if, then what do I do?
Trained physicians should be able to figure out those causes. Now, you may be surprised, but you're certainly not Dr. Levey or Dr. Davison, but our viewers out there may be surprised that the average gynecologist is really not trained in the evaluation of sexual pain disorders. That's unfortunate. So if the gynecologist you go to doesn't seem to know exactly how to evaluate that, or they just keep treating you for infection after infection after infection and your pain doesn't go away, it's time to look for a specialist in this area. Even a third of the people who got the original diagnosis correct are missing in another infection, which is a bacterial infection, bacterial vaginal.
I'm getting some awesome questions from our YouTube audience, and I'd like to have Dr. Goldstein and Dr. Davison address some of them. So YouTube audience member is asking, can birth control pills lead to vulvar pain or painful intercourse?
I don't want to throw out the baby with the bathwater and say that all birth control pills are bad, but if you had pain-free sex and started taking oral contraceptive pills, and at some point in time later develop pain with intercourse, very commonly that is a cause of the pain with sex. Now, the other part of that question was, can that cause other pain? Well, the answer is yes, because when you start having pain with sex, one of the most common things that happen is the pelvic floor muscles tighten up. And once they tighten up, then you can have additional complaints, bladder complaints, pain with bowel movements, bleeding with bowel movements. So one thing can lead to another. Birth control pills can be that patch of ice. They can lead you into a ditch and they can get your car smashed up. And often just stopping the birth control pill does not resolve the problem.
I have a couple of folks in the YouTube audience asking great questions about vulvodynia. Vulvodynia really just means pain in the vulva. If I don't have access to surgery, what are my other treatment options? What are the other things I can do to heal, or what can I do from a medical standpoint, it sounds like, to be able to help me with some of that?
That vulvodynia is really a symptom. It's just sort of saying, again, as you said, Dr. Levey, vulvar pain. One of the best ways to figure out the causes is a diagnostic algorithm that I've published, but that many people use and have changed. You can go to my website, which is called vulvodynia.com. Vulvodynia.com, and if you go under publications and under vulvodynia, that first publication under vulvodynia is the diagnostic algorithm, so that you and your physician can use this diagnostic algorithm to figure out exactly the cause of your vulvodynia. But about a treatment for neuroproliferative vestibulodynia, if you can't get surgery, and we don't necessarily recommend surgery for neuroproliferative vestibulodynia unless we call it congenital, meaning you've always had that. We found that if you have congenital neuroproliferative vestibulodynia, that surgery is by far the best option. However, if you have acquired neuroproliferative vestibulodynia, meaning you've had pain-free intercourse and then you develop too many nerve endings, then we have found a medication called capsaicin to be incredibly effective. Capsaicin is the purified extract from chili peppers. Now, what happens is you put this medicine on the vestibule, which is the entrance of the vagina. It's an incredibly painful experience. But what happens is it causes all the nerve endings to get depleted of the chemical that causes pain. It's sort of like wearing out the battery of the nerve endings. So if you can do this every single day for approximately 3 months, there's a 71% reduction in pain.
That's great. So there are medical therapies. We have used capsaicin as well. Dr. Davison and I use another medical therapy quite frequently. Dr. Davison, do you want to talk about that briefly?
One that we have used with success is a combination of estrogen, so giving the tissue, especially in patients who are maybe deficient from using a birth control pill, ketoprofen, lidocaine, gabapentin, so a couple of different agents mixed together, some that work on nerve modulation, estrogen that can improve tissue quality that also can be deficient after using birth control pills. So a topical like that. Also in patients who specifically have discomfort due to birth control pills, they're also deficient in testosterone, which I know Dr. Goldstein can chime in more, but super important to give testosterone and estrogen back to those patients via topical. So that's another, specifically for patients who've had a history of birth control pill use, that's definitely something that we see helps a lot.
And I have another question from a viewer that just came in. Do we recommend oral amitriptyline or gabapentin for unprovoked vulvodynia? And I'll just answer it by saying, yeah, there's no good evidence in the literature that treating systemically or centrally with these oral medications offers any long-term benefit to managing vulvar or introidal type pain. Those medications work great for other types of chronic neuropathic type pain, but for the vulvar type pain, they don't really seem to do much of anything by themselves. I'd like to get back to two questions that I think we could answer in brief. The first question is natural birth still possible after a vestibulectomy? Are there any long-term risks?
My patient population, women after surgery, 58% of the women have completely no pain after vestibulectomy, but after vaginal delivery, that number goes up to 93%. So actually, vaginal delivery can get rid of any residual pain after vestibulectomy. In addition, women actually tend to tear less if they've had a vestibulectomy than the average woman who's having a vaginal delivery. And the reason is what tends to tear during a vaginal delivery is the vestibule. And so women who no longer have a vestibule tend to not tear at all.